Hello, my name is Sudhakar Reddy, Consultant Orthopedic Surgeon. Today I am going to talk to you about arthroscopy and its benefits. Arthroscopy is a minimal invasive surgical procedure where we use a camera and pass some instruments into a joints to diagnose and treat conditions. Common joints we use are in the knee and shoulder, and as well as we use sometimes in the hip joints and the ankle joints. In the knee, common conditions we treat are what usually the ligament injuries. The meniscus is a common cartilage or a shock absorber which can get torn, injured while twisting injuries or fall from height. They can be repaired arthroscopically. Other common ligament is the ACL, anterior cruciate ligament, or the posterior cruciate ligament, which are the stabilizers of the knee. The ligaments also can be reconstructed using arthroscopic or minimal invasive techniques. Other conditions in the knee are when there is damage to the articular cartilage. Particularly in young people, we can preserve the knee by doing cartilage transplant or preservation procedures. Sometimes there could be loose bodies in the knee which are free floating and cause mechanical obstruction. The loose bodies can also be removed arthroscopically. Other conditions are sometimes in rheumatoid arthritis where the synovium is thickened and inflamed. We can excise the thickened inflammation tissue and relieve the pain and swelling. As well in the shoulder, where we can also treat in the shoulder with arthroscopic techniques. Commonly diagnosed conditions or treatable conditions are frozen shoulder, where the patients have pain and stiffness, and if they're not responding to painkillers and physiotherapy, we pass the camera into the joint and release the adhesions. Other conditions, rotator cuff tears, where there's weakness and pain on lifting, we could repair the tendons and suture it back to the bone to improve the function in the shoulder. Sometimes when there's pain on overhead movements, we could decompass the joint so that the tendon doesn't cause pain on overhead movements. Other conditions are in young people where there's a labrum, what we call the capsule, between this glenoid and this humeral bone. They get torn and there's a hole in the front and the shoulder tends to dislocate on certain moments. That also can be repaired, what we call a Bankart repair. It can be done arthroscopic techniques. And in other conditions like some biceps tendon, if they're torn, they can all be repaired. And like in the knee, if there's any inflamed tissue, we can remove it, excise it, or if there's loose particles, we can remove it. Advantages or benefits of arthroscopy: it is a minimal invasive procedure. It can be done as a daycare, can be discharged within 24 hours. It causes less pain because there's less trauma to the tissue, and there's less bleeding, and there's faster recovery to the patient.